This video is made to help parents understand what to do when their child is constipated. It will explain what constipation is and how to manage it at home. As a reminder, if you're ever worried about your child or the suggestions in this video are not working, you should take your child to see a doctor, nurse, or other healthcare professional. What is constipation? In general, constipation is when a child's poops are infrequent, difficult, painful, or when hard poops cannot be completely emptied from the body. Unfortunately, constipation is often left untreated, which can lead to belly pain, loss of appetite, and the inability to control bowel movements for kids. This can cause a lot of stress for families. For this reason, it is very important to treat constipation before it becomes a major problem. Contrary to popular belief, constipation is rarely caused by problems with organs like the intestines or stomach. In fact, functional constipation, that is constipation with no medical cause, is commonly caused or worsened by children holding in their poop in order to avoid painful bowel movements. There are several common times when kids become constipated. Usually the earliest is when kids have major changes in their diet, like when changing from breast milk or formula to solid food. It can also happen at other times when they have changes in their diet. Kids often become constipated when learning to potty train because they have some anxiety around using the toilet and tend to hold in their poop more. Kids will also become constipated when they go through major changes in their life, such as going to school. Many children don't feel comfortable using public washrooms, causing them to hold in their poop even more. This can make constipation worse. Children may also avoid going to the toilet because they're doing other important things, like playing. So why does poop become hard and large when a kid holds in their poop? When poop enters the final section of the large intestine, called the rectum, the circular muscle, called the inner anal sphincter, is relaxed. The urge to poop is triggered when the poop reaches the outer anal sphincter. When a child makes an effort to relax the outer anal sphincter, the poop can then leave the body. But if the child tightens this outer anal sphincter and their buttocks muscles, the poop is pushed back up into the rectum and the urge to poop goes away. When poop remains in the rectum for longer periods of time, the body gets more time to remove water from it, causing it to become harder and larger. Children may then poop their pants or get skid marks in their underwear when softer poop overflows around the hard poop. So now that we know what constipation is, we can talk about how to start fixing it. The first step to fixing constipation in your child is to recognize when it's happening. Some common signs of constipation include 1. Having 2 or less poops in the toilet per week. 2. Having problems controlling when they poop, sometimes resulting in poopy pants. 3. Showing signs of holding in their poop, such as clenching their butt cheeks, squatting, walking stiffly, crossing their legs, or sitting with their heel pressed against their bum. 4. Having painful or big hard poops. 5. Plugging the toilet. Often, well-intentioned caregivers might think that when a child poops their pants, it is because of a behavioral problem, like lack of self-control or not caring. Caregivers will then sometimes punish the child for pooping their pants to try and change the behavior. However, this does not usually help the situation and can actually make it worse. This is because the child can develop feelings of shame when pooping, and will avoid pooping even more. It is very important to remove these negative feelings and instead focus on positivity to help build confidence in pooping. There are many good resources for caregivers about toilet training. Stay tuned to this channel for more information, but in the meantime, you can check some links in the description below. Now that we know how to recognize constipation, the next step is to treat it. In most cases, your child's constipation can be safely dealt with at home. The goal of treatment is to make the child have soft, painless poops and prevent future constipation. There are 3 important ways to do this. First, medication can help make poop easier to clear out from the body. Second, diet changes can help to keep poop soft and regular. Third, helping children to develop a solid routine around using the toilet can get their body back on track. Here's what you can do. When a child has been constipated for any period of time, they will have lots of poop backing all the way up into their rectum and intestines. In order to have regular poops, all this backup poop needs to come out. There are many options to get this blockage out. These include things like enemas, or liquid that is squirted up the bum, suppositories, which is medication that is put in the bum, or medication taken by mouth. All of these options should help with constipation, but some work better than others. In general, suppositories and enemas can be traumatic for kids because it's understandably uncomfortable to have things put in your bum. There's been research that's been done that shows that appropriate use of medication by mouth works just as well as daily enemas and is much easier to tolerate by kids. For this reason, it is generally recommended by pediatricians to give medication by mouth first, because it's easier and works great. The medication recommended by most pediatricians is called polyethylene glycol 3350, or PEG for short. It comes in many brand names and should be available at any pharmacy. The medicine works by staying in your bowel, meaning that it is minimally absorbed into the body and brings water into the bowel to soften up the poops. For this reason, it needs to be taken with liquid. In order to clear out the bowel, higher than normal doses should be started until all the blocked up poop is gone. This usually means taking the medication at least 3 times per day. It is usually recommended to go up to 3 grams per kilogram per day when aiming for a bowel cleanout. Every capful of PEG, or 17 grams, needs to be taken with about 250 milliliters, or 8 ounces of fluid. Luckily, PEG is a tasteless, odorless powder. This makes getting your child to take it much easier. If you're confused about how much PEG to give your child, we have created a dosing calculator on our website, kidsforbeginners.com. You can click here to go there. All you need to know is your child's weight, and it will help you figure out how much they need to get cleaned out. The goal is to take high doses of this medication for up to 1 week or until their poop becomes clear liquid. Before slowing down the medicine, your child should have mostly clear, watery poops with no more chunks or brown coming out. When this happens, you know that all the backed up poop is gone. If you start the medication and your child doesn't poop right away, don't be discouraged. It can take a few days of high doses before the poop is soft enough to come out. Many caregivers worry about giving their child laxatives because they think that their child's bowel will become lazy or dependent on the laxatives to work. This is not the case for PEG. It is safe to use every day for months or even years. Once the hard, compact poop is treated and gone, the next step is to maintain your child's healthy bowel movements and prevent future constipation. This can be done by continuing to use PEG. You can adjust the dose based on your child's response, meaning the dose can be lowered if their poop is too watery or increased if their poop is still too hard. Ideally, you want to adjust the dose so that your child has 1 to 2 soft poops per day. Most children will do well with a dose that is 0.5 to 1 gram per kilogram per day in order to have regular poops. This medication should be continued for several months so that the bowel has time to get used to having normal poops on its own again. When you're constipated, the rectum gets stretched out and has difficulty sending signals to your brain saying that it's time to poop. It takes time having normal, healthy poops before the bowel gets back to normal. Maintaining a balanced diet is also very important for the treatment of constipation and the maintenance of healthy poops. A diet that is high in fiber and includes whole grains, fruits, and vegetables will help. Drinking enough water and other fluids will also help keep poops nice and soft. The next step is to make sure your child has a consistent routine around using the toilet. This means picking 1 or 2 times during the day, like in the morning or after a meal, where your child sits on the toilet even if they don't feel like they have to poop. Kids should not be punished if they don't poop. Set aside about 3 to 10 minutes on the toilet. This will encourage them to get all the poop out. It is good practice to prevent constipation and helps to get the body into a routine. Using a stool under the toilet helps kids poop easier as well. This allows kids to have their feet flat on the floor, making it easier for them to push. This can surprisingly make a big difference. Once you have achieved a regular poop routine with your child and they no longer have problems with constipation, you can take your child off medication. It is generally recommended that caregivers continue the medication for several months. During this step, make sure you maintain your child's toilet routine, fluid intake, and keep their diet balanced. When you stop the medication, it is safe to start it back up again if your child starts to show signs of constipation. They may need another big clean out. Hopefully this video helps families stop constipation when it happens. If you're ever worried, take your child to see a doctor, nurse, or other healthcare professional.